5:30 starts now.
Once again, the state is making changes that would affect the most vulnerable, which are, children on the spectrum who can't advocate for themselves.
Many Vermont families of children with autism are worried life-changing services their kids get now won't be covered by the state's insurance in the new year. Thank you for joining us at 5:30. I'm Darren Perrin.
And I'm Kiana Burks. Channel 3's Lucy Kale joins us now. Lucy, why is this happening?
Darren and Kiana, the Department of Health Access says it's being forced to make changes to a common therapy program to comply with state and federal guidelines and best clinical practices. But multiple service providers and families receiving these services have told me this will have a massive impact on the care their children receive.
I mean, it's been life-changing.
Chantel Roy Hewittson's son, Kit, was nonverbal before he started receiving Applied Behavior Analysis, or ABA, at Bounce Preschool.
And within 6 weeks of starting there, he started speaking, which he hadn't done before that, which was huge, right? And since then, it's just made steady gains.
She's one of many parents and service providers like Chris Keene worried about what will happen if the state cuts coverage for ABA.
It's potentially a catastrophic impact on access to ABA services for kids with autism that don't have any better options available.
In November, the Department of Health Access announced changes, including taking away certain telehealth services beneficial for rural families, removing a licensed assistant behavior analysis as a healthcare provider, limiting the number of people a program can help, and removing concurrent billing on ABA services. Right now, with the ABA services, a clinician works directly with a child on their approved program every day. And then to make sure that everything is appropriate and working well, another person comes in and makes any changes that they deem necessary. The DVHA says that means Medicaid has to pay for both people.
So this is to fix that and ensure that providers are not billing twice when we should be only paying for that service once.
Advocates believe both services are necessary. Without the two, providers like Courtney Keene worry about malpractice.
It opens the door for ineffective and possibly harmful services to be provided.
But DVHA Communications Director Alex McCracken assures that the state is making these changes to keep the ABA benefit by complying with federal rules.
Ultimately, it is DVHA's goal to preserve the ABA benefit for Medicaid members, and these changes are intended to help us do that.
However, Brian Merrier with Autism Advocacy and Intervention says providers feel like DVHA isn't working with them.
We've had exceptional quality collaborative engagement. There's a misinterpretation of things. And the sad thing is that all of these proposed changes happen behind closed doors without engaging with any of us,
leaving parents in a lurch.
If that's cut off from them, not because the parents choose not to go, but because Medicaid won't cover it, it's very unfortunate. It's hurting those children.
DVHA is taking public comment until December 25th. We will have the details on where to send those comments on our website. Now, if they go through with it, the changes will go into effect January 1st. Kiana and Darren.
Lucy.